once they're better, they're better. And in fact, we don't find the COVID in the fluid that the eggs come in. So, and putting them in the freezer, I think you could even take someone who has active COVID and get their eggs. We don't do that. What we do in our clinic, and we've done this since we reopened, we closed for 6 weeks starting in March when New York was the epicenter for COVID. We reopened April, and we've done about 1,400 retrievals, IVF, egg freezing. We've COVID tested every patient. Guess what? We've taught our patients and our staff and our team to be very careful. We have 2 patients who we didn't do a retrieval on because their eggs, because they had COVID, so we didn't do their retrieval. Out of 1,400, with a background 6% COVID rate in our city. Because if you wear a mask and you pay attention and you're motivated because you know you're in the middle of a cycle that's going to get canceled, you can do this safely, and we've done it safely. So, if you've had COVID and recovered, there's no evidence that it will affect your fertility. We've seen many pregnant women, not our patients, show up in labor with COVID and do quite well. Some have gotten very sick and still done quite well. It's not something we want anybody to have to experience. So you have to be careful, but we haven't stopped. We've had our busiest year in the history of our program, our 30 years of being here this year during COVID, and we've done it safely. And it's mainly because our patients are paying attention and being smart and making good decisions.